heavy agenda today. So some of the ground rules we're going to work with. I'm going to change the order of our agenda here just a little bit. I'm assuming we have several people who have signed up to testify. If you've been in this committee before, you know we start on time and we end on time. So to that end, let me take a look at the list. It appears all the people wish to testify want to talk about 495, so we are holding that one to last. And again, I'll try to hear as many people as possibly can, but as we get towards the end of the agenda, I'm going to reserve the right to limit the amount of time that we spend on this so we can get through this and get out at right at 9 o'clock, at 9:30. With that, let me go first with the consideration of referred administrative regulations. So I want to make sure we maintain a quorum. Any concerns about any of those regulations? Roll call. Yes. I'm sorry, I didn't hear you, Senator.
Senator Rocky Adams, Senator Berg, Senator Carroll,
Here.
Senator Douglas,
Present.
Senator Herron, Senator Mills, Senator Nemes,
Present.
Senator Rawlings, Senator Tishner, Vice Chair Richardson, Chairman Meredith.
Thank you, Herring, for keeping me on task here. Appreciate it. Again, changing the order of our agenda just a little bit. First, a consideration of referred administrative regulations. Any concerns, questions? There being none, we will assume that they're okay with everyone and move on. First bill we're going to hear this morning is House Bill 389. Representative Duvall, if you would, please come forward. Identify yourself for the record and feel free to proceed.
State Representative Robert Duvall, District 17, Warren County.
Josh Hardesty, Executive Director of the Office of Legislative and Regulatory Affairs at the Cabinet for Health and Family Services.
Please proceed.
All right. Chairman Meredith, Vice Chair Richardson, members of the committee, thank you for the opportunity to present today. House Bill 389 is simply a cleanup bill for the CASPR program. These changes cannot be accomplished through regulations, and this was requested by the OIG. There are several items, but the highlights are the following. House Bill 389 clarifies language that practitioners must have an active account with CASPR. It exempts providers who are engaging in charitable healthcare services from e-prescribing, since e-prescribing can create a significant cost for those charitable clinics. It gives authority for the Cabinet to share CASPR data with federal entities, such as providers who are employed by military bases in Kentucky. And also, hydrocodone is now a Schedule II drug, so all references to it being a Schedule III have been removed. And there is no fiscal impact expected. I'm happy to answer questions.
Is there a second? Excuse me. Second by Vice Chair Richardson. Becky, please call the roll.
Senator Rocky Adams. Aye. Senator Berg. Aye. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron. Aye. Senator Mills. Senator Nemes.
Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Tishner. Aye. Chairman Meredith.
Aye. The vote is 9 yes, no no's, so the bill passes with favorable expression.
Very good. Thank you, committee.
Thank
Appreciate
you for
it.
being here this morning. Appreciate it. Next bill we'll hear will be House Bill 392. Representative Proctor, if you would, please come forward.
Thank you. I'm Representative Mary Ann Proctor, the 60th of Boone County. Thank you, Chair, for being willing to listen to this bill today. House Bill 392 is just it streamlines the payment system and creates efficiency in the Cabinet for Health and Family Services. What it does is people who are in state mental facilities, if they require medical care, non-elective, that the state facility is unable to provide, This just allows for them to receive services in a community-based setting and that the community-based people may receive payment. That's all it is. So we're already responsible for people that are in the state facilities. There is no fiscal impact to the cabinet.
We have a motion on the bill and a second. All those in favor vote aye. All opposed vote no. Becky, please call the roll.
Senator Rocky Adams. Aye. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron. Senator Mills. Senator Nemus.
Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Tishner.
Aye.
Chairman Meredith.
Aye. Again, the vote is 9 yeas, no nays. House Bill 392 passes with favorable expression. Thank you for being here this morning.
Thank you, Chair.
We're going to move on to House Bill 501, which is an act related to the practice of pharmacy. And I believe it's the first time that Representative Whitaker has ever been before our committee, so glad to have you here. If you would, please make sure your mic is on and identify yourself for the record and proceed.
Hi, I'm Mitch Whitaker, State Representative for the 94th District. House Bill 501 provides continuity of care when a physician passes away. It allows the patient to refill the prescription for 180 days within the pharmacist's professional judgment. Currently, there's no law in the state of Kentucky that tells a pharmacist whether such a prescription can or cannot be filled, leaving uncertainty and potential legal liability for pharmacists. Importantly, controlled substances are excluded from the bill in compliance with federal law, and pharmacists will still be able to exercise their judgment and refuse prescriptions if they feel a follow-up appointment is warranted before that 180 days is up.
Motion on the bill. Is there a second?
Second.
Okay. Sure. I think we do have a second, but Senator Douglas has a question.
Thank you, Mr. Chairman. 180 days. We're looking at 6 months. What responsibilities do patients have for seeking other healthcare providers within those 6 months?
Well, I appreciate the question, Senator. There's nothing in this particular law that says that they have to go out and get something in that 6 months. I would hope that the pharmacist, with their professional judgment, would say you need to go see a new physician. The reason why it was 6 months, it was originally 90 days in the bill, was that it's my understanding there are some areas of the state where it's really difficult to get to see a new provider within a certain amount of time. So I would hope that the pharmacist would tell the patient if it's something that needs to be addressed by a physician within that 6 months, that they would send them to see somebody.
May I, Mr. Chair?
Yes, please.
I just want to express a concern in that there are a lot of disease processes that in 6 months can really, really take a bad turn. And unfortunately, we whether people like this or not, we have a population that often, it's kind of like water. It kind of, goes the easiest route. And some of the motivation sometimes is not to get out and seek health care. And my concern is there's nothing that says during this period of time the patient will actively seek to find another practitioner. I'm a little concerned that we're not putting any responsibility on the patient to mitigate that 180 days. It's just a concern that I have, but I just wanted to express that.
Thank you.
I
Thank you,
appreciate
Mr.
that, Senator. But I support the 180 days for the very reason you're talking about. In rural Kentucky, it's getting increasingly difficult to find primary care providers. And I've shared with many of you before, my youngest son is a primary care physician, family medicine. And I was told 1 October, some family friends mentioned that they were going to see my son as their primary care physician. I said, that's great. When are you going to see him? And it was 6 months later. That's the earliest they could get in. So that's the challenge. I understand Senator Douglas' concern, but I think at this point it's kind of outweighed by the shortage of primary care physicians in rural Kentucky, it's always a challenge. But I think that's something we should watch and should continue to monitor. And if we need to come back and make some corrective action, then we can certainly do that. So,
Thank you.
any other questions, comments? We do have a motion and a second. All in favor vote aye. All opposed vote no. Maggie, please call the roll.
Senator Rocky Adams. Senator Berg.
Explain my I vote. I agree with Senator Douglas that there is not much of an incentive for patients to try to find a new provider, and I am assuming the way this is written that we're not talking about controlled substances. So I am going to vote yes because we do have a significant provider shortage, and I could understand where somebody who needs their baseline medications may not be able to find a provider in time. That I can definitely understand. So I'm going to vote yes with some reservations. Thank you.
Senator Carroll.
Aye.
Senator Douglas.
Yes, and explain my vote just slightly.
Yes.
The other thing I don't want to do is I don't want to put pharmacists in a position of litigation for not trying to motivate that patient to find a new caregiver. And a lot of people don't understand that who aren't in the healthcare space. But that is a real concern. Thank you, Mr. Chair.
Senator Herron. Senator Mills. Senator Nemes.
Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Tishner. Chairman Meredith.
Aye. Again, 9 yeses, no nos. House Bill 501 passes with favorable expression. So
Thank you,
congratulations.
Chairman.
Good to have you here this morning. Our last bill for consideration this morning is House Bill 495. Representative Hale. Please come forward and introduce yourself for the record.
Good morning, Mr. Chairman and Vice Chairman, members of the committee today. Thank you for allowing me to be here this morning before you. My name is David Hale. I'm a state representative representing the 74th Legislative District. And again, thank you for the privilege, sir, of allowing me to appear before your committee this morning.
Good. Before you get into your presentation, we do have a committee sub.
Yes, sir.
I'd entertain a motion to approve.
Motion on the sub.
Motion is for a second. Second. All those in favor vote aye. Aye. Any opposition? All right. Please proceed.
Thank you, sir. We are now going to be presenting and talking to you House Bill 495, but working off the committee sub this morning. The committee sub is actually very, very short and very simple, and I'll be very brief. This sub on this specific bill states that there shall be no provision or there shall be no Department of Medicaid services unless there's something that's required under the federal law or any managed care organizations to whom the specific department might contract to deliver Medicaid services to. And what this does, it prohibits expanding those funds through those services for any cross-sex hormones in amounts greater than would be normally produced within a healthy person of the same age and sex. And the only other thing that this specifically states is that it also would prohibit any gender reassignment surgery to alter or to remove any physical or anatomy characteristics or features that are typical from a person's biological sex at birth. And that's basically it, sir.
Any questions from committee members? If not, we will move on to testimonies here. People who wish to speak for and against the bill. And by my count, we have 8 people. And time we have remaining, we can allot about 4 minutes, 5 minutes for each. So with that, I'll ask former Senator Alice Voorhees-Kerr to come forward. And Senator, great to see you. I'm glad you could join us. Not that I have to tell you, but just identify yourself for the record and feel free to proceed.
I have to get in this chair first. I've had a little back surgery. It really is good to be back, Chairman, and all you members, both ones I know and ones that I haven't really gotten to meet yet. Thank you for the opportunity for me to testify here today. I have with me today in the audience my younger son, Jameson Kerr, and I appreciate him being here very much. I come before you today, Mr. Chairman, not just as a former state senator, but as a mother. A mother who loves her son with all my heart and who knows beyond a shadow of a doubt that conversion therapy is not just ineffective, but it's very, very dangerous. The executive order banning it in Kentucky is not only morally right, it is necessary to protect our children. It is not only morally right, it is necessary to protect our children. My son Jameson is gay. I have a straight son, 2 boys. And I say that with all the joy that I can muster because he is a kind, thoughtful, and wonderful person. But I also know that not every child in Kentucky is fortunate enough to have a family that loves and supports them as they are. Some are sent to programs that try to change them. These programs don't heal, they harm. They don't counsel, they coerce. And that's not just my opinion as a mother. That's the overwhelming consensus of medical experts, mental health professionals, and those who have survived the trauma of conversion therapy, or torture, as I call it. The science is clear, conversion therapy is harmful. The American Psychological Association, the American Medical Association, Dr. Douglas, the American Academy of Pediatrics, and every other leading medical organization in this country have condemned conversion therapy as both ineffective and harmful. Studies show that these young people who undergo conversion therapy are more than twice likely to attempt suicide than their peers who are not subjected to it. In Kentucky alone, 45% of these youth seriously considered suicide in the past year. This was from a national survey for mental health. When we allow conversion therapy, we are telling kids that who they are is so wrong, so shameful, and that they need to be fixed. But there's nothing broken about them. What is broken is any system that allows this abuse to continue under the guise of therapy. Kentucky must be a place of protection, not harm. Kentucky is a place of faith, of family, of values. But what values are we upholding if we allow young people to be subjected to psychological abuse? This executive order does not take away anyone's religious freedom. Please hear me. It does not force anyone to believe anything. It simply ensures that those licensed professionals in the state cannot engage in a practice that is proven over and over to cause harm. I understand that some of you say or may have religious or personal beliefs that make this a difficult issue. But faith and love are not at odds here. As a lifelong Christian, I believe in the inherent dignity of every person. My faith does not tell me to shame or harm any child. It tells me to love him or her. And I would ask each of you to think about what kind of message we are sending to the young people of Kentucky if we strip away that protection. With all the pressing issues that face you today and during this session, our economy, our schools, our healthcare system. Why are we spending time trying to undo an executive order that simply protects vulnerable children from harm? The people of Kentucky did not elect us, you, to revisit settled science or to debate whether psychological abuse should be allowed in therapy offices. We have real issues to tackle in this state, and this should not be one of them. We cannot claim to care about mental health and youth suicide prevention while simultaneously allowing conversion therapy to continue. We cannot claim to be for parental rights while endorsing a practice that alienates children from their families and increases their risk of homelessness and self-harm. We cannot claim to govern with compassion while repealing a message designed to prevent suffering. I have a plea here for the children of Kentucky. I'm standing here because I have seen firsthand, when young people are told that they are not enough as they are. I have seen the heartbreak, the depression, the struggles of many youth who just want to be loved and they want to be accepted. I really pray that we do not turn the clock back because we would be harming these kids. Governor Beshear's executive order was one step forward. Repealing it would be a step backward, one that will cost lives. And I'm begging you, not just as a former senator, but as a mother, to think of the children whose lives may depend on the decisions you make today. That's pretty heavy. Thank you, Mr. Chairman.
Thank you, Senator. Appreciate you could join us this morning. Next on our list is Eric Russ, I believe. Yes, if you would, Mr. Russ, please come forward. Make sure your green light is on, and then introduce yourself for the record.
Thank you. My name is Dr. Eric Russ. I'm a licensed clinical psychologist and executive director of the Kentucky Psychological Association, representing over 1,000 psychology professionals and trainees across Kentucky. Chair Meredith and members of the Health Services Committee, thank you for the opportunity to speak today in opposition of HB 495, which lifts the ban on conversion therapy, and I guess the sub also bans trans healthcare now. The bill threatens the trust between a mental health provider and our clients. When someone walks into the office of a licensed mental health provider, they have the expectation that person will follow established standards of care and abide by their professional ethics standards in order to not cause harm. We now have decades of research demonstrating both harm from conversion therapy and benefit from gender-affirming care. The clear scientific consensus across the American Psychological Association, along with, as you've heard, every other major mental and medical healthcare group, all agree that the widely discredited practice of so-called conversion therapy has no place in the mental health care of LGBTQ youth. We know that survivors of conversion therapy not only do not change their sexual orientation, but have worse mental health outcomes. Too often, these outcomes tragically include suicide attempts and dying by suicide. Granting a license for mental health care is about protecting the public from exactly this sort of harm. When a kid walks into a licensed mental health professional's office with their family, we have an ethical obligation to provide them care that is supportive, evidence-based, and affirming to their gender and sexual orientation identity. This bill puts the public at risk by legislating unethical mental health care. I urge you to oppose HB 495.
Thank you. Appreciate your testimony. Appreciate the brevity in which you presented. Very clear, straightforward. Next on our list is Hannah Brosnan. Good Good morning. Glad you could join us. Make sure the light is still on in the speaker and identify yourself for the record.
Thank you, Chair and committee members, for having me. My name is Hannah Brosnan. I live in Fayette County and am Executive Director of Mental Health America of Kentucky, which seeks to educate Kentuckians and improve access to mental health services. I am here today to address the extreme danger that conversion therapy and inequitable access to care poses to the young people of Kentucky. I urge the committee to vote no on House Bill 495. As you may know, conversion therapy, also known as reparative therapy, is commonly referred to as conversion torture, and for good reason. Many of the methods used in conversion therapy are disturbing, shaming the child and creating an environment of fear. In extreme cases, children may be subjected to painful methods like electric shocks or nausea-inducing drugs while being exposed to same-sex images. Some therapists blame a child's close relationship with their mother. The child may even be told that God does not love them anymore. These destructive methods force youth to question themselves and their most fundamental relationships. As a mental health educator, I will share some very important data with you. A 2022 report from the Trevor Project, a national organization, found that 49% of LGBTQ youth in Kentucky seriously considered suicide in the last year. These youth are not inherently prone to suicide because of their sexual orientation, but rather because stigma, discrimination, and harmful practices like conversion therapy put them at greater suicidal risk. Every major medical and mental health organization, including the American Psychiatric, Psychological, and Medical Associations, has strongly condemned conversion therapy. Researchers have found that youth exposed to conversion therapy often develop anxiety, depression, substance use, and PTSD. A 2020 study found that young people were more than twice as likely to report having attempted suicide if they had undergone conversion therapy. From 2019 to 2023, 531 Kentucky youth ages 6 to 24 died by suicide. This is almost 4 times the number of legislators currently serving in Kentucky. This bill is not about politics, and it is not about leaning left or right. Voting no on House Bill 495 is about saving children's lives. I beg you all to think about a child that matters to you. Now imagine looking into their eyes and telling them, I voted yes for something that could hurt you. Now instead, imagine saying to that child, I voted no in order to protect you, because your life matters and it is my job to keep you safe. Senators, you have the power of your vote. I urge you to vote no to House Bill 495. Use your vote to protect our children. Thank you for your time and attention. I'd be happy to answer any questions you may have.
Thank you for your testimony, and I'm going to let everybody else continue their testimonies. If anyone needs to follow up with questions, we'll do that, okay?
Thank you.
Thank you, and appreciate you being here this morning. Serenity Johnson. Good morning.
Morning. My name is Serenity Johnson. I am a proud resident of Hardin County, Kentucky, and a proud transgender Kentuckian. First of all, thank you very much for the opportunity to speak today. I'm here to speak against House Bill 495. When an LGBTQ person, especially a child, comes out, whether it be to their parents, their teacher, their pastor, any other trusted adult, it's a leap of faith. We don't know how people will respond to how we come out, how we explain who we are, even if we think that they're going to be supportive. The best we can do is hope for the best, but plan for the worst. A lot of times it comes out in the middle, but not always. And it's scary even to think about doing it. It's also scary not to do it because you're having to hide a part of yourself, knowing that that part of yourself is so core to your being and that somebody can find it out at any moment. But when that fear of rejection is compounded by the fear of being subjected to long discredited practices, of attempting to change the very core of who you are, That's terrifying. It's especially terrifying to those kids who know what those practices entail. The last speaker went over some of those, so I won't waste your time going over again, but I'm also further disheartened by the fact that language is being inserted into this bill denying health care to transgender people. It's hard for me to put into words how much access to hormone therapy has helped me become who I am, helped me just live my life. But I'm lucky enough that I have insurance through my job, so this doesn't necessarily affect me directly, but for those on Medicare or Medicaid and who don't have any other recourse, this is denying them necessary health care. And it's not just a denial, it's a cruel denial. And I will hope that everybody here understands what that entails and the damage that that will do to them. Other than that, I'm asking this body, pleading with this body, please vote no to this bill in both of its forms. Thank you.
Thank you for your testimony. Appreciate you being here. Always good to have my neighbors from Hardin County come to Frankfort.
I was happy to be here.
Right here. Next is Brenda Rosen.
Good morning. My name is Brenda Rosen. I'm the Executive Director of the National Association of Social Workers Kentucky chapter, and very proud to be sitting next to one of my former senators from Fayette County. So nice to see you again, and thank you for everything you said. I will say that we are a little quite taken aback by the addition of House Bill 154 into this HB 495. At least it reads like that. I want to share that yesterday I had a moment with hundreds of other people, including the amazing Senator Berg and Herron, at the Fairness Campaign rally, where hundreds of Kentuckians gathered to celebrate, to honor each other, to renew continued faith and joy and intention to fight these bills. And I have to share, are we here in the Bible Belt to beat our people down with the belt or to hold our people up? We're talking about people, their innate way that we all are created and born. There is no such thing. There is no evidence-based practice. There's no such best practice or research that speaks to the fact that we can talk or pray the gay away or talk or pray the straight away. We are all born as we become in life, and we absolutely need to support that. I want to read just very quickly a couple of statistics from the Trevor Project of what young people want people in their life to show their support and acceptance. 90% say, trust that I know who I am. 84% say, don't support politicians that advocate for anti-LGBTQ plus legislation. 84% stand up for me. 66% say look up things about LGBTQ identities on their own to better understand. And 65% say ask questions about LGBTQ identities to better understand. It is our responsibility and our job as humans to make sure that we are not discriminating or shaming people because of the way they were born. And I'm deeply troubled by this sub into this bill because it definitely adds to it yet another assault on our brave Kentuckians. I think we can do better. We are seeing enough mental health crisis in our state for kiddos up to people of triple digits. It's our time to work together to make sure that we are not causing any more suicides, that we're not causing any more distress. I am sitting here pleading with you, please oppose this bill as written. Thank you.
Thank you. Appreciate your testimony. Next on my list is Chris Hartman.
Senator. Mr. Chairman, Chris Hartman, Executive Director of the Fairness Campaign. How dare you all?
Whoa.
This is a subversion, Mr. Chairman.
No, we're not going to start by yelling at this committee
Okay.
members. I'm going to ask you to step away from the table. This has no place for this. This has been a great conversation so far. I'm not going to allow you to berate the people in this committee. Do you
Okay.
understand?
Yes,
if
sir,
you're going to
Mr.
raise your voice to
Chairman.
me, I'm going to ask you to leave. Do you
I
understand?
hear you, Mr. Chairman.
Well, make sure you do.
Yes, sir. But I want all of you to hear me, including you, sir.
I can hear very well, but you don't have to yell.
This is a
I appreciate your passion for this, but this has been a great conversation from people so far. I've seen you come to this committee before and yell at people, berate people, try to sway their opinion in a way that is totally unacceptable. I will not accept this from you.
Okay, Mr.
And I'm going to
Chair.
tell you, if you start again, I'll ask you to step away from the table. And if you refuse to honor that, I'll ask somebody to remove you from the table. Do we
Yes,
understand
sir.
each other?
Yes, sir.
Then take a deep breath.
I'll say the words in the way that
Make sure
are
you do.
respectful to you. But this is a disrespectful subversion of the legislative process. These people were prepared to testify on House Bill 495 on conversion therapy. What you have allowed, Mr. Chairman, is a sneak attack on our transgender community without public input. It's a clever trick.
I'm sorry, I don't respect the inflammatory remarks. If you want to speak to the bill, feel free to, but again, you're not going to attack the integrity of this committee or this chair. Last warning.
Mr. Chairman, this
Last
is unfair. What you are doing now is denying life-saving, medically necessary health care to an untold number of Kentuckians without debate. This late in the game, because folks don't want to have this debate. You will cost lives. This was not the original intent of this bill at all. I'm disappointed, Mr. Chairman.
Wouldn't be the first time. Thank you.
It actually is.
Chloe Atwater, I have you next on my list.
Good morning.
Good morning. Please identify yourself for the record.
My name is Chloe Atwater. I'm at Kentucky Equal Justice Center. Thank you, Mr. Chairman and members of the committee, for the opportunity to speak. As I said, I represent KEJC, a nonprofit law firm focused on poverty law, particularly for vulnerable populations such as LGBTQ youth and trans people. I'm here today to voice our strong opposition to this bill, as well as the committee sub that would ban Medicaid coverage for gender-affirming care. As a former queer kid who grew up in small-town Kentucky, I understand the unique challenges that LGBTQ youth face. I'm fortunate to now be happily married to a woman, and I'm grateful that I was never subjected to conversion therapy. Conversion therapy is widely condemned by leading medical organizations, and allowing practices like conversion therapy to continue is contrary to principles of liberty and personal rights. No child should be subjected to practices that seek to change who they are. I urge this committee to reject this bill and prioritize the well-being of vulnerable minors, following the advice of medical professionals who stand firmly against conversion therapy, including my own sister, who's a board-certified pediatric and adolescent psychiatrist. Regarding gender-affirming care, it is my position as a health justice poverty law attorney that bans on Medicaid funding for gender-affirming care violates the Medicaid Act in multiple ways under the availability and comparability provisions of the Medicaid Act. It also violates Section 1557 of the Affordable Care Act, which does apply in Medicaid, Section 504 of the Rehabilitation Act, the Americans with Disabilities Act, and various provisions of the Kentucky Constitution. This is a position shared by many courts across the country, and a question posed in a series of cases in which petitions for certiorari have either been approved or pending before the U.S. Supreme Court and are likely to get granted. Absent their ruling, passing this bill will lead to litigation, I promise, in addition to the grave harm that it would cause to low-income transgender Kentuckians who I serve every day. I encourage you from a legal perspective to abstain from considering this kind of bill until their decisions have come down, and from a moral perspective to abstain from doing so regardless of what these decisions contain. Thank you for your time and consideration.
Thank you. Appreciate your testimony. That's all I have listed that's speaking against the bill. I have one person signed to speak in favor of the bill. So if Senator, you'd step away from the table, I'd ask Nick Spencer to come forward. Please make sure your microphone is lit. And identify yourself for the record.
Thank you, Chair. Members of the committee, my name is Nick Spencer. I'm the Director of Policy for the Family Foundation of Kentucky. I am an ordained pastor, and I'm also a PhD student studying ethics and public policy. I'm here today to speak in favor of House Bill 495. I want to set the scene for you for a moment. Imagine you have generalized anxiety disorder, and you walk into a counselor's office, and that counselor says to you, "I'm sorry, but I can only affirm your generalized anxiety disorder. I cannot help you overcome your generalized anxiety disorder." In the same way...
Excuse me for interrupt you. We're going to maintain decorum in this committee meeting. If we can't do that, I'm going to ask people to leave. Again, this has been a great conversation by a lot of people, very respectful conversation, and I expect it to continue in that vein. Do we all understand each other? Thank you. Sorry to interrupt you.
Thank
Please
you, Mr.
proceed.
Chairman. In the same way, Governor Beshear's executive order that limits the free speech of counselors on the issues of gender and sexuality says that same exact thing. It says to counselors, to pastors like myself, you can only counsel in one direction on this issue. I fail to see how we would stand for such a thing in any other context. Counseling, at its core, is a conversation between one person who comes in with a problem and one person who comes in with a suggested answer. The government has no business in policing what those answers should be as long as someone is not exposed to physical abuse or sexually explicit material. And I want to be clear, to the extent that individuals, especially minors, are exposed to physical abuse and sexually explicit material, that is morally wrong, and those persons ought to be held accountable. However, I also want to be clear that those who hold to the historic Christian faith would agree with me that those practices have no place in counseling, but they would also agree that counseling, talk therapy, is morally permissible. We've heard this morning that certain organizations have in their ethical standards that practices termed conversion therapy are outside of those standards. Well, the American Association of Christian Counselors, the largest Christian counseling organization in the United States, has as part of their ethical standards that their counselors cannot, in accordance with those standards, counsel in favor of homosexual or transgender expression. So, it is not in every major organization's ethical standards that talk therapy in that direction is prohibited. I also just want to say from personal experience, I have counseled a number of individuals who have expressed same-sex attraction. I come from a family where my own mother experiences same-sex attraction. Her brother committed suicide because of issues in their family, most likely having to deal with same-sex attraction. My mother knows where I stand on this, and not for 1 second has she ever doubted my love for her. I love my mother very much. She's been through a lot. She's overcome a lot. But my view on these things does not diminish my love for her. In fact, from my perspective, those who counsel against homosexual and transgender feelings are expressing love for an individual. We've heard this morning that that conversion therapy tells somebody that there's something wrong with them and that they need to be fixed. At its core, that's the purpose of counseling, is to help somebody fix what is broken. And speaking as a pastor, I would say that everybody in this room, myself included, is broken and in need of fixing. I agree that every person in this room is made in God's image and that they are equally valuable and worthy of respect. But I also agree that something happened in Genesis 3 that continues for each one of us today, and that the most loving thing we can do is help all people turn to that which is the ultimate solution for their brokenness. How do we know that God loves us? Scripture says that while we were still sinners, Christ died for us. John 3:16, I'm sure many of you in this room know that. For God so loved the world that he sent his one and only Son, so that whoever believeth in him shall not perish, but have eternal life. That's my role. That's my calling, is to help every person, boy, girl, black, white, young, old, gay, straight, turn to the one who offers the ultimate solution for their brokenness. Now,
Mr. Spencer, you have about one more minute.
Thank you, Chairman. Again, I just want to remind everybody, at its core, the executive order that this bill addresses is addressing that executive order because we would not and should not accept similar directives in similar circumstances. Maybe you're not a Christian this morning. Maybe you're here, you're listening to the sound of my voice, and you don't accept Christianity. That's your decision. But what I would say is, even if you're not a Christian, I don't think you would want to go into a doctor's office or a counselor's office presenting with some sort of problem that you would like to see fixed and be told that the doctor or the counselor cannot help you fix that problem because of government directives. That's the whole purpose of our First Amendment, both religious freedom and freedom of speech. Thank you.
Thank you. Appreciate it. I'm going to ask Mr. Hartman to come back. Excuse me, not Mr. Hartman, the David Hale to come back to give a summation of his bill and entertain any questions.
Thank you, Mr. Chairman. Thank you very much. I appreciate the opportunity to just close here, wrap up. There has been a lot of discussion here this morning. Faith has been mentioned a lot. I too am an ordained pastor in the church organization that I belong to. I certainly have many friends. There are people that attend the church that I pastor that have children that are gay. I have no problem with that at all. I love them, everyone, just as much as I do any person. My intention here this morning is not to show hatred to anyone in this room. I believe the things that have been mentioned, the executive order that was done in September of 2024, certainly the governor has that prerogative to do that, but I believe that parents have the right. We've talked a lot about parental rights this morning. I believe that parents have the right to raise their children the best they see how, the best they know how. And if they choose to seek a counselor, a therapist, a pastor, an individual in the ministry, I think they should have every right to do that. And I don't think that just one person with an executive order should be able to strike that down. So thank you, Mr. Chairman, and members of the committee, and I will certainly, if I can, answer questions. If you have any, I'd be glad to if you want.
Where we are in this meeting, it looks like we have about 9 minutes left, so I'll leave about 4 minutes for questions, and we'll try to proceed from there. Senator Burr.
Thank you, Mr. Chairman. And my question is actually for the lobbyist from the Family Foundation. You made a statement, sir, for the interest of time. I'm going to
Before everybody starts, let's be respectful of the time. I know that we're very time crunch here, and I finish at 9:30, okay?
You made a statement that you found it really bad, that somebody would go in to their doctor or their therapist or whatever healthcare provider and be refused treatment.
I made the statement that if somebody were to go in with generalized anxiety disorder and there was an executive order that said you can only affirm somebody with their generalized
This was
anxiety
later
disorder.
on, sir. In your closing, you said that people have the right to receive treatment.
They have the right to receive the treatment that they desire. And
Okay, then you need to explain to me how you reconcile that with the addition to this bill banning Medicaid from covering transgender treatment for adults. I need you to think about the discrepancy between your statements and explain how you justify that.
my justification is that the government has no business spending tax dollars on elective surgeries and elective procedures for people with transgender feelings. There are many medical procedures that the government does not cover, and the government has no business covering those services. Now, if someone who is an adult wants to pursue that course of treatment on their own dime, I would disagree with that course of action, but that is their right to do so. The government, though, has no interest in covering those procedures on the taxpayer dime.
So it is, in follow-up, okay for a family to reach out and ask for treatment that legally I wouldn't be able to suggest for a family, because I know, legally, I know that the outcomes are worse. I'm not allowed to suggest a chemotherapy that I know the outcomes are worse than the other options we have available. That would be unethical and immoral of me to do that to a patient in need. How do you justify a treatment that you know statistically we have seen doubles the risk of suicide in this population?
Senator, there are medical associations over in England that were previously on the leading edge of this issue from the LGBTQ perspective that are now pulling back on support for these procedures. And
I'm not going to get into the details
Senator,
of what...
allow him to
Okay.
answer the question. Be respectful of him. You asked the question. Allow him to answer the question. We'll answer this question, then we're going to move on, okay?
Yes, sir. There are many individuals who have undergone these procedures and these treatments who then come out and say that they regret those procedures and those treatments, that those procedures and treatments were pushed upon them by medical providers or by family members. The government has no business in paying for these elective procedures. It does have an interest in paying for chemotherapy because that is a physical disease that someone is suffering from. But the government has no business in paying for elective procedures for gender transition surgeries, whether you are young or old.
Thank you for that answer.
Thank you,
Senator
Senator.
Carroll, you have a question?
Mr. Chairman, the one thing I needed today is not here, and that's to hear from an therapist that does these therapies. So I'm gonna ask Representative Hale, and I did some research on this last night, and my comments and my questions are purely based on 495 because I've got to get past that first before even looking at the other part of it. The comments about drugs, about shock, about techniques that are perhaps abrasive, or if something that a counselor did to a kid in a school, they would probably, be held accountable for that. Do those things really happen? And I know people exaggerate things to support their side. I'm well aware of that. I've been here long enough to know that. But what are the options that a therapist has in this?
Well, thank you very much, Senator. Having actually also myself looked back into what some of the procedures that had been done in conversion therapy, and I certainly never would condone anything that would be of some type of a physical harming or showing pictures or audios of things or videos of things that would certainly be pornographic in nature, as I have heard has been done in the past. I have heard that many years ago, and probably in the 90s, maybe the late to early 90s, early to mid 90s. I can't exactly say for sure, but probably 30 years ago, I think probably some of these procedures were used. I had heard they were used. Honestly, I don't think that they are being used today. I certainly believe that they aren't, but I will say this in all transparency. I think that there at one point there were things that were used that were certainly definitely wrong and very, I think, abusive to the individuals that was being done to. So, but honestly, sir, I do believe that today those are not happening.
Thank you. That's all the time we have for questions. Is there a motion on the bill? Is there a motion and a second? All those in favor will vote aye. All opposed will vote no. Becky, please call the roll.
Senator Rocky Adams. Senator Berg.
Explain my no vote.
Be brief, please.
I will, sir. I was a no to begin with, simply because, and I want to tell you, sir, everybody has told me that you have gone to great lengths to make the first part of this bill much, much, much better. And I really appreciate that. I appreciate the humanity that you showed in doing that. I really do. You add the second part of this bill on, where literally adults who know who they are, whose medical treatment, contrary to your lobbyist back there, almost exclusively is either a shot or a pill. And we're going to deny them that. I mean, it's like, to me, and this is not an equivalency, but to take a bipolar patient and say, we're not going to give you your lithium because you just don't deserve it for some reason, even though it makes you better and makes you be able to face the day as a normal human being. But we're not going to do that because we just don't like people who are bipolar. No, thank you.
Thank you, Senator.
Senator Carroll.
Mr. Chairman, I'm going to explain my vote.
Yes.
Mr. Chairman, it's for me, just looking no further than that child. That's as far as I'm going to go with this. And looking at whether or not, looking at the statistics and what I read, the risk of it increasing suicidal rates, is it worth forcing that on a child with some of the techniques that I've read that are, I don't feel it's my place to judge anyone. That's our God's place to do that. Nor do I want an LGBTQ ideology forced upon me or my family. I resent that just as much. So looking no further than the kids, just concerned about this. My understanding from reading the executive order is it allows neutral therapy, and So that gives me some comfort, and I really feel like in these incidents, that's where it needs to go. It needs to start neutral and not push any issue to the point that it could be detrimental to the child either way. And this type of therapy seems to go in with that sole purpose to change someone, which if that young person, that child, is not prepared for that, I could see that being very detrimental. And Mr. Chairman, I just can't get past that part of it to even consider the other part of the bill. Thank you.
Thank you, Senator.
Senator Douglas.
I would explain my vote.
Please be brief.
Mr. Chair, I haven't read any place where, and Representative Hale can correct me if I need be, where it makes conversion therapy mandatory. Does your bill do that?
Senator, we cast your vote first so that.
I did. Aye.
All right. Okay. Thank you.
May I respond? May I
Well,
respond?
let me. In the interest of time, it doesn't. It does not. Just to let you know that. Unfortunately, suicide rate in the trans community in 2022 was up to 80%, or at least the consideration of suicide. And in some studies, the actual suicide rate was between 40 and 42% in 2023. We have an issue going on already. This bill, at least the way I read it, doesn't make anything mandatory. I think we have to really be careful about trampling on our Second Amendment, our freedom of speech. Our First Amendment freedom of speech right. So,
thank you, Senator.
Senator Herron.
Mr. Chair, I'm a no, but I would like to explain my vote. I do want to thank the folks who have come and testified, and they have said a lot of the things that that I wanted to say. But I do want to say something. I remember calling my mother after midnight when I came out to her, and one of the first things that she said to me was, "What do you think God is going to say about this?" And I quickly said to my mother, "Well, Mama, you raised me in church. I'm a Christian. I attended and still a member of the African Methodist Episcopal Church." And I said, "What you have always taught me and what my mentors and the church has always taught me is that God has made me the way that I am." And I was a basketball player at the time in high school. And I made a joke and I said, "God made me short. I wish I was a little bit taller, but this is the way he made me." And I said, "I deeply believe in the depths of my soul that God made me perfect and there's nothing wrong with me." And my mother had some time, and it took her a while to understand and accept that I am queer. And what she said to me later on was, "Thank you for being bold and brave and coming and talking to me, and thank you for trusting who you are and whose you are." And it's very interesting to me in this body and in this committee
Senator,
that on one hand,
you need to sum this up. as quick as
I will.
possible.
That on one hand we talk about self-determination and we talk about our rights, but then the other hand we talk about the Bible. And what I do know is that the Bible also says, "Do not use my name in vain." So you cannot use the Bible's to discriminate. And it also says, "Thou shalt not bear false witness." And so some of the things that we say in this religious context, but then also try to also display hate is just not it. And the last thing that I will say, the Bible always says, "Vengeance is mine, says the Lord."
Thank you. Appreciate that.
Senator Mills.
Mr. Chairman, I vote aye. Just want to make a comment that I'm not a medical expert, but I think I'm right on this, that Kentucky Medicaid does not cover these services currently in the sub. So I vote aye.
Thank you.
Senator Nemes. Senator Rawlings.
I'm an aye, and may I register my attendance? I'm testifying in another committee. May I?
Not during roll call.
I can't register my vote for the other. Okay. I'm a aye,
Senator
thank you.
Richardson.
Aye.
Senator Tishner. Chairman Meredith.
Aye.
Got six.
Vote is 6-3, so Senate Bill, our House Bill 495 passes with favorable expression. We do have a title amendment. Is a motion on the amendment? Motion.
Motion, yeah.
And a second.
Second.
Second. All in favor say aye.
Aye.
Any opposition? All right, thank you. Appreciate everybody testifying today.
Thank you,
Appreciate
Mr. Chair.
the dialogue we've had. With that,
Now I may register my votes?
Yes.
I'm sorry, yes.
Yes on 389, on 392, and on 501.
Mills. He's already.
Senator Mills, would you like to register any votes?
Thank you, Mr. Chairman. I register aye on the 3 previous votes. Thank you.
Anyone else we missed? If not, we stand adjourned.